Hi there, my name is Jaycee and I'm going to be conducting your oral facial examination today.
Okay.
And your name?
Marwa.
And your age?
24.
Perfect. Awesome. Okay, so first of all, I just want to kind of go over with you what we're going to be doing today. So basically, I'm just going to be looking at the structure and function of all your speech mechanisms. So your lips, your tongue, your jaw. Make sure everything is working correctly. Sound good?
Yep.
Perfect. Okay, first, so I'm just going to take a quick look at your facial symmetry. So look straight on at me. Perfect. So you good facial symmetry, good symmetry of the lips. Perfect. And there's no air escaping from the mouth at rest, which is great. Okay, and no abnormal movements at all during rest. Awesome, perfect. Okay, so next we're just going to look at your jaw. So I'm just going to get you to open and close your jaw as wide as you can. Perfect. So good symmetry while opening and closing, good range of motion. Awesome. And I'm going to get you open as wide as you can and move the lower portion of your jaw from side to side. Perfect. Awesome. Good range of motion, good movement, normal and smooth. Perfect. So now I'm just going to check for some noises. So I'm going to get you again to open your jaw as wide as you can. And close. Open. Okay, so I do hear some grinding, a little bit of popping in the jaw during movement. That. Perfect. Okay, so next we're just going to look at your teeth. So I'm going to get you to smile really big for me. Perfect. So kind of really good symmetry of the teeth, all aligned really nicely. Good oral hygiene. Can you open your mouth for me? And smile again once more. Perfect. Awesome. Good occlusion of the teeth. No overbite or underbite, which is awesome. And open one more time. And you also have all teeth present. Great hygiene. Perfect. Awesome. Okay, so next we're just going to look at the lips. So I'm just going to get you to pucker your lips and say, ooh. Awesome. So client has good range of motion, good symmetry. Perfect. And try one more time for me. Ooh. And try just touching your tongue blade against your lips while doing it. Ooh. Good. It's a good strength. Perfect. Okay, next I'm just going to get you to smile really big again and say E. Perfect. So good range of motion. One more time. E. Good. Good symmetry. Awesome. Okay, so next I'm going to get you to hold your breath and hold the air in your cheeks. So, okay, perfect. So one more time. Okay, so let's check here. Awesome. So client doesn't have any nasal emissions during, so good lip strength. Perfect. Awesome. Okay, so next I'm going to look at your tongue a little bit. So I'm going to get you to just open your mouth for me, just normal at rest. Perfect. It's a good color of the tongue. Nothing out of normal there. Perfect. And I'm going to get you to stick it out as far as you can. Good. And back in, and out, and in. Perfect. It's a good movement of the tongue. Good speed of motion. Perfect. Good symmetry. Awesome. Okay. And open one more time for me. And just try to set your tongue down at rest. Perfect. Leaning towards me a little. Okay. It's a good size of the tongue in ratio to the mouth. Your tongue tip up to the very top of your mouth. Perfect. Good size of the frenulum. It's normal. Awesome. Okay, so next I'm just going to get you to stick your tongue out as far as you can again, and back in your mouth, and out again, and back in your mouth. Perfect. It's kind of good range and speed of motion, and good excursion. There's no deviating to the left or right. Next, I'm just going to test your tongue strength. So I'm going to get you to stick your tongue out one more time. I'm just going to press this against your tongue, and you try to push it as hard as you can, okay? Perfect. All right, and I'm going to get you to stick your tongue out one more time and move it to the left and right. It's a good range and speed of motion. Now I'm going to do the strength test one more time to the left. So I'll get you to stick it out there and press as hard as you can. Perfect. And to the right. Perfect. And open as wide as you can. Awesome. Great. So good strength on both the left and the right. Okay, now stick your tongue out one more time and get you to stick it up and touch the top of your lip. And down as far as you can. And up again once more. And down again. Good. It's a good range and speed of motion. Moving up and down. Perfect. The tongue's looking really good. So now I'm just going to look at your pharynx. So I'm just going to get you to tilt your head back a little bit. Open your mouth as wide as you can for me and stick your tongue out. It's a good color. Client still has their tonsils. Good normal size. Color pharynx. Perfect. Okay, so I'm just going to look at your hard and soft palates now. I'm going to get you to open your mouth one more time and just lean a bit towards me, head up. It's a normal color of the hard and soft palate. The rugae is not predominant, it's normal. Good interior, height and width of the dental arch. Here's normal. Okay, not seeing any fistulae or growths. Great. And also no clefting present at all. Awesome. And very good symmetry as well. Okay, so next I'm going to get you to open up your mouth and say "ah" for me. And stick out your tongue, please. I'm just going to use this on your tongue. Perfect. So it's good phonation, good posterior and lateral movements during phonation. Good symmetry of movement as well. Can you do one more time for me? And say "ah." Good. So uvula looks normal. Awesome. Last, I'm just going to check for nasality. Do the sound one more time, please. Perfect. Some nasal emissions, absent during phonation. Okay, and so lastly, I'm just going to check your diakinetic rate. So, together, I'm just going to get you to repeat after me. We're going to do the syllables pa, ta, and ka. So, I'm going to try that.
Ta, ka.
Perfect. So, you're just going to try to say that as fast as you can, and I'm going to time you for 15 seconds. Okay, you understand?
Pa, ta, ka.
Perfect. Awesome. Okay, ready?
Yep. Go. Pa, ta, ka. 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 Pataka, 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 pataka.
Okay, great. Thank you. That was awesome. Perfect. Great. That's really good. Appears to be normal. Awesome. Well, I think that's everything for today. Thank you so much for participating.
Yeah, thank you.